Preventative care isn't always on the top of our minds. People may not think about taking measures to stop an illness, but they will focus on treating it once they're sick. The same rule can apply to one's skincare routine.
Sunblock and sunscreen is basically along the same lines. You don't see the consequences until later.
When families get to the pool, park, or playground, kids want to get straight to the fun part, making the process of applying sunscreen even more difficult.
Children are moving targets, and to get them to sit still for the period of time it takes to apply sunscreen properly can be very, very difficult.
According to Dr. Gardner, children are more susceptible to sunburn.
The skin of a child is thinner. The skin of a child is certainly more sensitive. It tends to have less natural melanin pigment than in an adult.
Making a thick layer of sunblock necessary.
FDA and the other agencies, they say 2 milligrams per square centimeter of sunscreen.
And actually measuring out that amount of sunscreen might sound a little bit confusing. But in the case of adults, the FDA recommends about half a teaspoon for things like your face, your neck, and your arms, and that'll be about the size of a nickel on your hand. In the case of your legs, your stomach, and your torso, you'll want something a little bit larger than a quarter. That works out to about 1 full teaspoon.
It's calculated, and I'm checking my sheets here, by comparing the amount of time to produce a sunburn on sunscreen protected skin versus the amount of time to cause a sunburn on unprotected skin. So, for example, sunscreen with an SPF of 30 would allow a person to multiply their initial sunburning time by 30 if applied appropriately.
It's not guaranteed to last that long.
Because of how it's applied, human sweat, washing off in water, variety of other factors.
Dr. Gardner says children less than 6 months old should avoid sunlight. But if parents want to take their 4, 5, or 6-month-old for a quick dip in the pool,
cover up with clothing is certainly superior to any sunscreen. I would certainly cover that baby with a shirt of some type, a swim shirt, a hat on the head. You slather them with a high SPF sunblock. You dunk them for a couple of minutes, get them back in the shade.
Without those precautions, the burn can cause
headache, nausea, fever, chills, and at its most severe, even delirium.
Next time you visit the drugstore to pick up sunscreen, the American Academy of Pediatrics recommends looking for broad spectrum with an SPF of 15 or higher. For Arnot Health, I'm Lexi Cutmore.